Perfect. So good morning, everybody. Happy Friday. My name is Jordan Eller, and I'm one of the community services managers here at Alta Regional Center. Mr. John Decker is on a well-deserved vacation day, so he will return next week. And we do have a nice schedule of topics for you guys today. I will start out by introducing some of our Alta team. So Miss Michelle is one of our community services specialists. Good morning, Michelle. I see Goldie Lohr is on, one of our service coordinators out in the Yuba City area, and Alicia Gauchi. Good morning, Alicia. She's our HCBS specialist. And Beverly is new to our community services unit, and she is within Helen's team. We have Miss Shirley. Good morning, Shirley, one of our day program experts. And Mr. Bobby Powell, good morning. Scott Barr, one of our quality assurance specialists. I see Veronica Hallgren, who's a client services manager out in our Woodland office. And good morning, Zach, John's executive assistant. And good morning to Heather, one of our specialized resource developers. And Mary Rettenhouse, who's going to share with us today. Good morning, Mary. She's our autism specialist. I see Dana is on. Good morning, Dana from case management. And Jessica is also one of our case management service managers. Sorry about that. And Gary is in community services. I see Jason. Good morning, Jason. Jason's one of our leads in our community services department. And Isabella. Good morning, Isabella. She is from community services, specializing in our residential services. I see Jessica is on from case management. Good morning, Jessica. And Miss Michelle Johnson, our client director. Good morning, Michelle. Hannah's on, one of our client services managers from the Roseville area. And Miss Christina Lane from our manager from our residential unit. And I also see Miss Jennifer Bloom. Good morning, Jennifer. And good morning to Francesca. Francesca is one of our new 1 to 25 service coordinators in Judy's unit. We got lots of folks on today. I see Adriana, Herman, our training manager, Phil, one of our residential managers, Helen's on. Johnny Zhang is on, one of our associate directors. I also see Rima, our deaf and hard of hearing specialist. So good morning, folks. We are excited to share topics with you today. And I know our first presenter is going to be Mary Rettenhouse from our clinical department. So I am going to make you a co-host, Mary. I just have to make sure I do it accurately. So give me just 1 second. Where'd she
Jordan,
go?
I'm having romper room flashbacks with your introductions. Anyone else?
And I'm trying to, there you are. Okay, cool. Oh, here we go. I have to go this way. There we go. Rettenhouse. You know, for some reason, guys, I'm having issues with doing the co-host.
Are you able to spotlight her?
How would I go about spotlighting her?
Jordan, this is one of the other sign language interpreters. It doesn't look like you're even a co-host or a host. It looks like Eileen, the interpreter, was made a host.
Oh, I see.
She may need to give host back to you, so then you can make other people co-hosts.
Thank you so much. Appreciate that.
And this is Eileen. So would your name be under John's name to give
Yes.
you that back? Okay.
It would be,
correct.
yes.
One moment, please, and I'll do that. Okay.
Okay, let's see now if I have success. Here we go. Okay. Mary, the floor is yours. Thank you guys for your patience.
Awesome. Good morning, everyone. As Jordan mentioned, my name is Mary Rettenhouse. I'm our autism clinical specialist. So I am in our clinical department at Alta Regional Center. For those of you that work at the regional center, you know that, but our provider network here may not be aware. And one of the things that we do in the clinical department is provide training and technical assistance, not only to our staff internally, but also to our providers. And so we are coming up on a nice workshop for our providers on prompting, specifically tailored for our adult service providers. So if you're interested in that, hopefully you've signed up. Otherwise, we can host multiple of those presentations, or you can reach out to me directly as well if you are interested in that training. But today, before we get into that, I want to share with you all a nice project that we did to provide enhanced training to some of our care homes across the state, and what the outcomes were, what the client outcomes were for that. So in my role, I also participate in a statewide training network called CAPTAIN, stands for California Autism Professional Training and Information Network. It's a mouthful, so we just stick with CAPTAIN. And within that capacity, I provided training to 3 different care homes, their staff, help select goals. And so we'll share with you what the outcomes of that were, and then also what the free resources are for you so that you can receive the same training and access that as well as your staff. So I'm going to share my screen. Let's see, I'm gonna make it full screen. Okay. I'm gonna share my sound. We do have a little video clip in here. And then I'm going to get rid of this meeting controls. Okay, can someone come off mute and let me know if they are seeing this presentation? It says CAPTAIN Adult Resources and Evaluation. We
Looks
are.
good, Mary.
Awesome, thank you. Okay, so that is what this project is. It's called CARE, or CAPTAIN Adult Resources and Evaluation Project. So what we'll go over, and some of this I'll run through quickly, just because the project process is probably less interesting, I would say, than maybe the outcomes and the resources. But I will briefly touch on the mission and vision of this project, and then that process, which included assessing and evaluating the needs of our adult service providers, as well as what we did to address those needs, which was to adapt and implement evidence-based practice resources, and then what the outcomes were of that project. So within CAPTAIN as a statewide network, it is a multi-agency network of folks from family resource centers, regional centers, special education local plan area, personnel, so the SELPAs, the school districts participate, as well as folks from higher education. I think we have 6 different universities in our state represented. And so this multi-agency network, generally, what our goal is to just improve outcomes and quality of life for our folks with autism and intellectual disabilities. So the CARE project specifically was funded through a grant provided by the Organization for Autism Research, or OAR. So why did we want to provide training and resources to our adult service providers? Well, we have some, I would say, kind of unfortunate and shocking data from the Interagency Autism Coordinating Council. Their latest publication came out and talked a lot about the challenges that are faced in working with adults with autism, primarily because we have kind of lack of a well-trained and motivated workforce. And within that workforce, really not a lot of use of evidence-based practices for skills teaching or behavior management. And that is linked to poor pre-service training, meaning it's not in the DSP curriculum. It's not in orientation and initial higher service training. Also, lack of supervision, meaning clinical supervision. So lack of a supervisor that can provide you the ongoing training and coaching in those practices. And just generally a low sense that the use of evidence-based practices is even an expected part of the job. A lot of our direct service professionals have the idea that, you know, they're there to provide care and supervision, not necessarily that they're there to provide intervention or treatment or therapeutic outcomes. What we need to know, though, especially for our adult service providers, is that while children may make up about 80% of our state's population of people with autism, that wave is headed your way. These children are gonna grow up. So we need to start adapting our services and programs now because we have about 50,000 children with autism annually aging into adulthood. And this is statewide data. So our two major goals with this project was to try to help enhance some of our adult service programs by providing education on these evidence-based practices so that we could improve the overall service delivery and the outcomes. So people actually meeting their ISP and other objectives. So how did we get there? Here's kind of an overview of our roadmap or what our plan was to get to that point. So we started with evaluating client, staff, and agency characteristics and needs, adapted training materials. So there is a lot of training materials out there for folks, but they're generally more tailored for people that provide services to children. So our adult service providers, they just don't really relate or see how they can use those same training resources. Then we move to providing that training by doing both didactic as well as hands-on training and coaching to our service providers, and then evaluated whether or not that was effective for helping our clients to meet objectives. So a little touch on our evaluation piece. What we did was we did service provider and family member surveys. And then we also did focus groups and site assessments. So going out to our homes, going out to our sites to see, are we using any of these practices currently? We had just a couple of family members, so not heavy on the family member side. We did have 73 administrators and about 13 DSPs that responded to our survey. And the primary areas that they identified they'd like more help with is the area of behavior, which totally makes sense. That's usually the biggest challenge for everyone across the board, as well as how to help folks be more independent with their ADLs or their adaptive daily living skills. And we provided them this list, which is from the 2020 publication from the Clearinghouse on Autism Evidence and Practice. And they have come out to say, okay, these are the 28 evidence-based practices. So we asked our service providers, which of these do you think you would find most helpful? Granted, the caveat being that I'm not sure all of them knew exactly what these practices are at this point, because remember, we are asking people that don't have prior training typically on these things. So their thought was antecedent-based interventions or just how to be more proactive, as well as functional behavior assessment. And some additional things we learned through doing the focus groups were some of the barriers to training right now. From our admin's perspective was staff's qualification and knowledge. Admins felt that the level of training or the level of content in the training was too advanced for staff, and they didn't have the foundational understanding to be able to grip onto the concepts well enough, as well as staff attitudes and engagement. A lot of staff just not really motivated to participate in training activities, as well as what everyone's been dealing with over the last few years, staff shortages, turnover, and then just not having time, largely in relation to that staff shortage. We don't have time to have staff come away from being on the floor or with clients directly to take those classes or to go through formal training. And then the trainings that do exist, all the video examples and all the settings really just show kids in school settings. And so it wasn't relatable for them. So some suggestions that we received for going into developing our materials was to use simple and plain language so people can really access it, understand it, use more scenario-based trainings, do trainings for both staff and admin, have some level of accountability. So don't just throw the training out there and cross our fingers and hope that we actually do it, but actually have some follow-up to that. And then with that, some supervision to actually observe application of that knowledge to see if the knowledge is being implemented correctly. And then also provide some interactive platforms just to increase engagement. So not just send you a PowerPoint, but maybe have a virtual learning platform, for example. We also did a bunch of in-person site assessments where we went out to facilities and gathered information on how evidence-based practices are currently being used. And some of the things that we found is that none were currently using any type of visual, individual, or group schedule. So not talking about the calendar that's posted with the tiny like 8-point font writing of the activities every day, but ones that would be accessible for our clients, say for our non-readers, for example. And none were using visual step-by-step instructions for those long or multi-step difficult tasks, like how to use a laundry machine. There were no visuals or no supports, like visual recipes for meal prep or anything like that. None were using visual timers for those that are unable to tell time or read clocks. And generally support was provided in more of a do for rather than do with or help you to do fashion. So just to give an example, one of the goals that was set was to help someone get dressed independently. But what staff were currently doing is when the person said, oh, I'm cold or something like that, the staff would just go and get the person's jacket and put it on them, rather than say, okay, if you're cold, what do we need to do? Go get your jacket? Okay, great. Let's go get your jacket and support that person with doing that independently. So we put all of that pre-assessment information together and met with our advisory board to determine which training models we were going to develop. And we came up with prompting and visual supports. So we developed these two evidence-based practice training modules. They're in an interactive online learning platform. They've been adapted specifically for adult service providers. So all the examples include adults and real videos and things like that. There are pre and post tests embedded, as well as activities and comprehension checks. And then here is just
determining
a
when,
little sample.
with who, and under what circumstances to use prompting can be a challenge. Let's take a look at this short video clip. You will see Erin, the woman on the right, asking Emily, the woman on the left, if she is ready for a meeting with her service coordinator. As they enter the building, Erin notices a sign on the door that says face masks required, and she promptly puts on her own face mask. Watch the video to see if this existing environmental cue is enough for Emily, or if additional support could be provided.
So that's just a quick sample of what that virtual learning platform looks like. So there's videos embedded, and then you'll see little interactive questions and comprehension checks come up that then when you select one of the responses, you get feedback on whether or not that was the correct response. Okay, so once we determined which practices we wanted to develop the resources for, we also decided that we needed to really do a broad reach and try to select sites from across the state. Unfortunately, we only got responses from Northern California. Our goal was to have 3, so we ended up with 3, which was good. but we provided the training to 3 licensed residential facilities, 1 in Alta's catchment, 1 in Far Northern's catchment area, and then 1 in Golden Gate Regional Center's catchment area. The training was provided to 7 staff members and 1 parent, which was kind of interesting. We had 1 adult's parent who just was heavily invested and really wanted to participate as well, which was kind of neat. And then we had 7 clients that signed up to participate, and each client having between 1 to 3 goals. So each staff person received 3 hours of workshop style training and then weekly coaching to use those practices, the visual supports and prompting, for a period of 5 weeks, which is not a lot of time, right? To meet an ISP objective. I was not hopeful, to be honest with you all, that we would really get anywhere. There were incentives because this was a grant funded project, so that was really nice. Each staff that participated got $100 for their participation, and then each client also received $100 for their participation, and each site received a unique tailored visual support startup kit that was about $200 in value. So that really depended on what the client goals were. So for example, the getting dressed goal was for one of the homes, and it was across 3 participants. And so we had a lot of organizational type materials that we helped develop for them and put together, like a shoe rack and a coat rack and, signage and stuff like that. Okay, and then for the visual supports and prompting workshops, that 3-hour didactic training, 2 of the sites received it in person, 1 received it virtually, and that was just based on preference. And then here's some examples of the knowledge assessments, so pre and post test for both visual supports and prompting. So on average, we saw a little increase in our providers' knowledge of visual supports between pre and post test, 11%, and then a more significant increase with the prompting of 24%. At least the scores didn't get worse. That's what I say. Okay, so then we move to goal development. So how are we actually going to apply these practices to the individuals and their goals, the people that we serve? So this was largely based on individual needs, individual preferences, strengths, characteristics, and the overall fit with the visual supports and prompting as practices for teaching those things. So here are the objectives that we addressed for each of the sites across each of the folks that participated. So you can see site 1, we had 3 clients, each had between 2 and 3 goals. Anything from, we worked with the rec therapist actually for that one. She was having a lot of difficulty getting folks to even participate in the activities she would bring out, and she would bring out really cool stuff. But unfortunately, 2 of the clients really just would refuse to participate with her. So we wanted to increase their participation in their rec therapy so they could actually benefit from that, as well as that dressing routine. And then one gal, she really actually enjoyed the rec therapist, but she would then interrupt other people's sessions because she wanted to kind of keep the interaction going. So we addressed that. For site number 2, we had just 1 participant that participated, and her 3 goals are listed here. The first one, which was probably the most impactful, reducing her morning routine from an hour to, or sometimes up to 2 hours, to 20 minutes. She would get kind of caught up in some ritualistic behavior, and then sometimes she would miss her transportation to day program. So we really wanted to make a difference there. And then also make her own meals. She really liked to try to do meal prep, but needed a lot of support with that, and staff being not 1-to-1 ratio, couldn't always support her when she needed to. So on that note too, to help her move toward independence with meal prep, meal planning, all of that, creating a grocery shopping list and purchase the items on her own. And then for site 3, we had 3 clients participate, and each one had one goal. We had a showering goal, we had a meal prep goal, and a laundry goal. So you can kind of see a broad range from anything from leisure skills to ADLs to behavior goals. And here's some examples of the visual supports that were created across the sites to address those things. And you can't really see what she's holding, but I love this picture of Yolanda. She was our Site 2 administrator. She's holding up a morning routine visual and she's making the sign number 1 because in 20 years of being an admin, this was her first visual support that she had ever made. So she was super proud of herself. As far as the implementation piece went and what the timeline kind of looked like, just to give you an idea, we started last September, and then we went through the months of November through January with intervention and doing the training. So not a long time. Obviously, we didn't know how this would turn out. We hoped it would be impactful and effective, but as I kind of shared with you all previously, in 5 weeks, I wasn't hopeful. I didn't set that timeline. I just was a trainer. And so, given my experience, I've been at Alta for 13 years now, and given my experience, sometimes I see folks with the same ISP goals, behavior goals, year after year after year. With maybe little to no movement. So I wasn't necessarily thinking that 5 weeks was going to be enough time to even know if these things were going to work. But we did have some good outcomes, which I'm going to share with you, but this was really impactful. And so this is what I'm really most excited to share with you, is that even before we expected to see anything, we got some really unanticipated early outcomes from using some of these strategies with an individual that wasn't formally participating in the program. And so you'll hear Yolanda, the Site 2 admin, talk about this experience and how impactful it was. And this was only within the first week, I want to say, of using these strategies. Okay, Miss Yolanda, so nice to check in with you. So at this point so far, we've had some materials delivered to the residential facility that you work out with your 4 ladies that you support. And I'm interested to know what kinds of materials you've started to use already, and if you've seen any results so far.
When you came in and you taught us about visual prompts, was really interesting because we have a schizophrenic in the house, very mentally ill, who just obsesses over cigarettes to the point where she became very antagonistic, would upset her roommates, just constantly cigarettes. We've tried everything to get her to understand, look, it's every hour that you can have a cigarette. We just don't have the staff, and you shouldn't be smoking every 4 minutes. Although it's your right, you can go out every 4 minutes. But this woman, unfortunately, has declined down so rapidly that she doesn't even walk anymore. So we have to physically take her out. A lot of times, because we are a 4I with behavior modification, we have a lot going on, and sometimes we just can't leave the women alone, especially 2 in the house. But when we were talking about, and you had that clock sent to us, I set the clock up and I thought,
The time timer with the red wedge.
With the red, yes. This right here is the Messiah of cigarettes.
It will happen.
It will happen. And reaffirming that with her, with that visual, we've seen in 3 days, I could not believe it, 85% improvement. And I'm going to tell you, from that time when we talked, she's almost at 100%.
Wow.
She knows, and she'll remind us sometimes when we bring her back into smoke, you know, we put the visual back on and sometimes we'll forget, hey, she'll say, my visual. Oh,
Oh,
sorry.
she's reminding
So
you
she's
now.
reminding
At my
us.
I love
She's
that.
reminding us, but it also helped the house. She got an eviction notice because her behavior, she was so antagonistic. Her peers are now sitting out in the community room because she has to be in the community room because she doesn't, she can't walk anymore. And, you know, she will jump out of her wheelchair to probably find a cigarette. So we have to, she's a one-on-one. But now they're coming out and watching movies with her. Now they'll color with her. For the first time yesterday, they all ate at the table together. They were able to handle it. She wasn't, go get me a cigarette. Calling staff, you know, it wasn't this antagonistic kind of bully behavior. And it was really nice. It was really nice to have them all communal.
Yeah, so it sounds like it's not just impacted her and her behavior, but also just the dynamic of
Damage to the
whole
house.
home.
Yeah.
I can't believe, I mean, I can because we know visual supports are evidence-based, right? But I really can't believe how powerful something as simple as a visual timer was
It
for this.
made the difference in her placement, her housing, her peers, my staff. She was a one-on-one because of her behaviors. You had to sit with her and we would have to pull her out of the room right away when she started upsetting the rest of it. She's not a one-on-one. I can use that resource over to another client that
Okay.
using in this study who's having a hard time too right now. So it was really nice. I'm like, wow, I don't even need her to be a one-on-one because she's not doing it.
Well,
And-
and that's good. That's going to be good for staff retention too, right?
Yes.
Yolanda, I just have to say thank you so much. I'm so impressed by you. You are such a self-starter. You know, this wasn't even anything we had planned to do. This was
I know.
your own idea, based on the training that we had, and you just took it
it
and ran
was.
with it. And I am so grateful to you and all of the hard work that you're doing. So keep it up. I'm so excited to see what more we could do together.
And thank you to you and your guys' team because that, you know, I can't say enough. I even told the CEO, I said, I cannot believe just a visual did this. My God, it is a clock with red. Who would have thought?
Let's buy one for every house.
I would never, right? I would have never known. So thank you guys. It was really helpful. And, you know, printing out things, we printed out things, you know, first we put water, toilet, smoke, you know, and then she knows it's within this time. So, you know, and we have it by the clock. So it's really, it's nice. The visuals do work. They work.
Well, I don't think I could have said it better myself. So we like to share that video because it's a true testimonial of just how impactful these evidence-based practices can be, and they can make life so much easier for your staff too. So you know, that's why we are passionate about getting this information out into everyone's hands, because you can't benefit from practices you don't know about. Staff and clients, right? So, so here's the overall outcome. So site one, those goals that we went over, what you'll see is the yellow dotted line was the goal. So that's where we wanted to get to. And then anything above that would be exceeding the goal. So for example, if our goal was that someone could, you know, if you could reduce your getting ready routine from an hour to 30 minutes, but then the next level up might be 20 minutes and the next level up might be 15 minutes, then that's what we're looking at. So we call that goal attainment scaling. So that way we can track not only did you meet your goal or not, but did you meet different levels of the goal? So maybe you met a little bit or you increased a little bit, but didn't quite get there as well. So you can see that key up at the top. Baseline is that -1 all the way up to a 4 would be far exceeds the goal. So each goal had multiple measures that they could potentially meet, and everyone at site one met or exceeded their goals. So again, guys, this was a 5-week project. It's crazy, but it really happened. I still can't believe it sometimes. So I probably wouldn't believe it if I didn't do it myself. Okay, so site 2, same. Stacy, our gal that was wanting to do her own grocery shopping and meal prepping and getting to day program and not getting stuck in her morning routine, met all her goals, also in 5 weeks. And then site 3, we did have 2 people meet their goals, and then 1 person, poor Scott, he did not quite make it to getting to doing his own laundry, but you can see he did at least move from baseline, and he did meet the initial objective, but we tried to troubleshoot, we just couldn't quite get there. So overall, we had 92% of goals met. And this was between that 5-week period. And then we did, after 1 month, followed up to see if there had been any change. There was also a huge increase in all of our 3 sites in terms of their use of the visual supports. So that evidence-based practice, you can see site 1, their pre-score was only a 1, and then they advanced all the way to an 11. So just meaning that, you know, they're really increasing their use of visual support. So overall, the average was that our providers improved their use of visual supports by 44%. So really big. And then overall, I think what this story tells us is that now we have increased knowledge and use of evidence-based practices by our adult service providers. So before this project, 71% of our providers said they had no formal training in visual supports. So that's a big impact. If we can get everyone access to this, then hopefully that number is only going to be, you know, a few percentage, and maybe it only reflects people that are really new to the field. And then most importantly, we saw improved client outcomes that ultimately led to an increase in their quality of life. And I think that's what that story from Yolanda really says to me, is that this led to increased quality of life, not only for that one individual, but also for all of her housemates, because they then could enjoy participating in group activities together. So this project, while the funding has ended, the resources still live on. And so all of our regional centers across the state are planning to host at least 1 visual supports or prompting workshop each year. So at least we can kind of get that out to whoever is interested annually. And we do know, though, that workshops alone are not going to be enough. Here's some data on what kind of level of implementation you get from doing different kinds of training components. And it really isn't until you have that coaching piece. That's where we need the boots on the ground, the follow-up, the modeling with staff, the giving them the feedback in the moment, and then coming back again if we're really going to make that meaningful change. So the workshops are great, but like I said, alone, we're not going to get real implementation. So we continue to search for the right resources, the right partnerships, grants, things like that, so that way we can continue to scale up this type of project. So I'm going to actually end us here and stop sharing.
Thank you, Mary.
Yeah, and see if there's just any questions, if anyone had any comments.
I just think the results are so exciting, Mary. And I feel like I could watch those case examples all day long. Just fascinating to me.
Well, Jen, you'll
Yeah.
have to come by my office because I do have some really fun client videos that
Okay, I would
would
love
just
to.
make this presentation way too long. But yeah, one of the gals putting on her shoes independently for the first time and her talking about how proud she is. I did it, you know.
Oh my gosh, I
it's
love
really,
it. Such
it's really
positive.
cool.
Yeah.
That's outstanding. Yeah, so thank you, Mary, so much. That's a awesome project, and it's so cool to see the outcomes.
And like I said, for our provider community, we do have these resources that are available to you in this virtual learning platform. Those can count as CEs for your staff as well. So if you're interested in that, please connect with me or your community services specialist and
Mhm.
have them connect with me, because I can help you get set up with that free account. And it's free. Oh yeah. Did I
Right?
say that?
The silver lining. That's great, Mary. Mary, would you want to drop your email into the chat in case
Yeah.
folks need that, right? And like she mentioned, you can always reach out to your community services specialist. If you're not sure who that is, you can reach out to Christine Hobbs, our CSS office assistant, and she can provide you that info. Thank you so much, Mary.
Thank you guys for having me.
Yeah. And so next on our agenda, I know we have Michelle Johnson, who wanted to share some information about the DSP workforce survey.
Thank you, Jordan. Do I
Yeah.
have the ability to share my screen?
You should as co-host. Yes, let me know if you have any problems.
Okay. Are you guys able to see that?
We see your screen with us on it.
You don't see the PowerPoint?
We don't.
Oh, okay.
Maybe just share the opposite screen. I know I always have so many windows open at my screen. Michelle's trying to find the right one.
What
Now we
about
see
that?
it.
You do?
We see it.
Okay, perfect. All right. Hi, everybody. I'm going to talk a little bit about the data collection meeting that I attended on Wednesday. DDS did a webinar because they are interested in collecting data from our agencies that employ direct support professionals. So we know that the workforce is experiencing challenges, and DDS wants reliable data about those challenges in order to inform policy, design recruitment and retention efforts, and examine the impact of the rate initiatives. And so again, this survey is about to come out next week. In terms of who can take the survey, vendor agencies within the rate model that provide in-home supports, residential supports, and non-residential supports. I know those categories are really broad, and in a couple slides, DDS will break down what service codes are eligible. So only one survey for each vendor agency, must have been in operation for at least 6 months in 2022. And then vendors participating in the survey may receive an incentive of $8,000. So this is the second year of those $8,000 incentives for participating in the survey. So on this slide, and this PowerPoint is from the presentation that DDS actually used in the meeting on Wednesday. So that's where I got this from. So they go into a little description or definition of who DSPs are: individuals whose primary responsibility is to provide support, help with skills development, supervision, and persistence to those with IDD. Also, paid staff members who spend at least 50% of their hours doing direct service tasks, full and part-time DSPs providing residential in-home and or non-residential support. So these are individuals who DDS is really, or these are the agencies that DDS is really hoping will take the survey. DSPs that fall into these categories, they're not included in the survey this year. So DSPs not funded through a regional center, DSPs that are clinically licensed or certified employees, therapists, nurses, etc. Employees only providing transportation, home modification or meal delivery, administrative or supervisor employees whose primary job responsibility is to provide support, help with skills development, supervision, personal assistance to those with IDD, contract or 1099 workers, on-call or PRN workers. Again, individuals that fall into these job descriptions are not included in the survey this year. And this slide, again, represents those service codes of the vendors who do fall in the survey. So under residential supports, vendors who are vendored as community care facility and RCFE, ARF push-in, vendors providing out-of-home respite, vendors providing foster home services or vendored as a family home agency. Those vendors are included in the survey. Under in-home supports, again, examples of service codes, ILS, SLS, personal care services, those who are vendored to provide homemaker services, in-home respite, and under non-residential supports, vendors who provide day services, employment or vocational services, community supports, all included in the survey. You must be registered to, you must register first for the survey. And so again, this slide just again reinforces that you need to have first register and be sent the link for the survey. I'll skip over that. These are the topic areas that are going to be covered in the survey: agency profile, compensation, bonuses and overtime, recruitment and retention, payroll data. Again, this is information that'll be collected from our vendors. I'll skip that slide, tips for survey success. I know this is an important slide. Under eligibility for the survey, vendor must meet requirements listed in the DSP workforce survey, must answer all survey questions. And this is a timeline that the survey will be processed, and also a timeline that DDS anticipates those participating in the survey will receive their payment. And I'm going to post these links in the chat. Again, this information is all available on the DDS website, and I'll cut the links from this page and paste them in the chat.
Excellent.
And these are the dates for the survey. I'll stop sharing my screen.
Perfect. Well, thank you so much, Michelle. And I know $8,000 can mean a lot to a program, right? I mean, that's a significant amount of funds. So, and of course it can help improve our service system, right? Biggest part. So, okay. And so I know we're going to have a few agenda items that we might not be able to get to today, but I definitely want to make sure that we have time for REMA to be able to announce the ASL forum that will be coming up and doing our sign of the week. So I'll give the floor to Miss REMA.
Great. Hi, everybody. I'm really excited that the ASL forum with the providers who have deaf and hard of hearing students and staff at all levels, really, everybody's welcome. The forum, really, the goal is to provide support and resources, and at the same time, to share amongst each other, not just from me, then to work together and to share with each other about accessibility and success for deaf and hard of hearing. We're looking at September. The date is undefined right now, but I'll give you more information as we get a little closer. So now it's time for sign of the week. Are you ready? Copy me. So the sentence is, please sign slow. And the second sentence is, again, please. Okay, so here's your hand shape. Please follow me. Sign slow. And make sure that your eyebrows are creased. That shows that your intensity of you don't understand what's going on. Didn't understand what somebody signed to you, and you're signing, please sign slow with the facial expression. And again, some of you maybe look at this and say, could you sign it again? So here you go. The second sentence, again, please. That's always so much appreciated when we're asked, because sometimes deaf people can sign quite fast and you may have caught a little bit, but not at all. Don't just sit there and nod your head. Ask, please sign again. We always appreciate that. People are learning sign. We understand that. So please ask us to either slow down or please sign it again. So do you want me to share the Deaf 101 too as well, Jordan? Do you want me to share that?
Yeah, that'd be great.
Okay, great. So let's talk a little bit about, don't be afraid to repeat yourself. Sometimes, you might know what that is, but just ask. Ask it to be repeated again, and that's fine. We're always happy to repeat. Also, the reverse is true. And perhaps you may have a hard of hearing person who speaks, and you might not understand what they're saying. Don't say, oh, never mind, or hey, later, I'll tell you later. That's harmful. Just repeat what was said, because they may ask you to repeat what is being said. So be patient with the deaf and hard of hearing who may ask for a repeat. And a word is dinner table. So when we look at the dinner table, that's where the most common information is shared as you're growing up with a hearing family. And remember, 90 to 95% of deaf children come from a hearing family. The family's not signing, or maybe there's one person in the family that knows sign and they become the interpreter. And often people around the table are laughing, and then the family says, oh yeah, we'll tell you later. It's like, so they're missing out on that dinner table socialization time. So it's really impactful for deaf people as they're growing up. Then there's a frustration that they're missing out on a lot of that social time. Just if they ask for a repeat, make sure that you're patient and repeat that. They provide that and know and it's important for them to know what's going on. Thanks, guys.
Thank you so much, Rima. Any questions on that? Right. Don't see anything popping up in the chat. Thank you so much, Rima. And then Jennifer Bloom, did you want to speak to, I know Helen isn't on right now. Did you want to speak to the 637 public meeting we'll be having in May?
I sure do.
Okay.
Yes.
Excellent.
Okay. So we are submitting a proposal to the department to waive the median rates for specialized therapeutic services in Early Start. So specifically, occupational therapy, speech therapy, and physical therapy. The median rates are really prohibitive in attracting the volume of therapists that are needed to serve the children in Early Start. So we're going through the AB 637 process, and that is a proposal to waive the median rates and to allow the regional center to pay our specialized therapeutic services providers at the market rate. So we're very excited. It's been a long process. I've had to, and it's been really wonderful. I've made a lot of connections with all of our OT, PT, and speech therapists vendors to talk to them about, if we were able to waive the median rates, how would that positively impact the children and families of Early Start? What would you be able to offer that you're not able to offer now? How many more slots, therapy slots, would you be willing to give us? Things of that nature. So this public meeting is part of the proposal process, and we're seeking public input. We will discuss the fiscal impact, because you can imagine that there will indeed be a fiscal impact. We will need to spend more money on these services. The upside to that, of course, is that the children and families who need the services will be receiving them, rather than being on wait lists or even potentially aging out of Early Start before really being able to fully benefit from the services that they are entitled to and the services that they need. So that public meeting is going to be on Friday, May 15th at 12 noon. It's just half an hour. We'll go through everything I just shared, but in more detail. We'll share some data. We'll share the fiscal impacts, and then we will have a 10-day public comment period. And after that public comment period, we will be submitting our proposal to the department, and thinking good, positive thoughts that everything will be in order and we will be able to offer the market rate to our providers. So thanks, Jordan.
Yes, of course. Thank you so much. Any questions from anybody for Jen? All right. So we did have a couple other agenda items, but we'll shift those to next week since we're coming up to the end of our time frame. And John Decker will be rejoining us next Friday for Coffee with Community Services. I want to thank you guys all for joining us, and we'll see you next Friday. Thank you.
Thank you.